right, thank you, John. Hopefully you guys can hear me. If not, I am sure I will find out shortly. And we today, like John said, are going to talk about some common heart disease medications, or heart smart medications. So I try to not get too much into the details with these presentations because I know not everything is applicable to everyone. So if you guys have any questions you want to ask, feel free to interrupt me, throw any questions into the chat box. Or if you don't want to say something in front of everyone or think of something later, my email is up on the screen, kind of always on my email. So more than welcome to field any questions via email as well. So always available. So I know that you guys have probably reviewed this already, but we'll do a little basic overview to start out with. So what exactly is heart disease? So basically, heart disease is the result of what happens when a lot of things happen in your body, but mainly when the blood vessels become either damaged or diseased. So we a lot of times call this coronary artery disease, or CAD. And a lot of these terms that you'll hear today are kind of interchangeable. What can often happen here is that fats and lipids, so things like cholesterol and LDL, can build up over time. And this is something that usually happens over years and years. And over time, these fat buildups in our blood vessels cause something called plaques, which is basically just a collection of cholesterol and lipids. This can lead to blocked blood vessels. Obviously, blood can't flow through as easily, which unfortunately can lead to things such as heart attacks or strokes due to decreased amount of blood flowing through the vessels. And of course, can also cause blood clots. So things that we try to prevent here, like I said, heart attacks and strokes, blood clots, arrhythmias. This is kind of a fancy term for saying a heart rhythm that is not normal. The most common one of these is going to be called atrial fibrillation. If you watch the news in the evening, there's always commercials that mention atrial fibrillation, or as what many people refer to it as is AFib. And then of course, heart failure. So medications for heart disease, a big thing to remember here is that if I asked everyone in the chat box what they were taking, and you guys don't have to say, but if I asked everyone what they were taking or what their spouses or family members or parents took, everyone's going to probably have a different answer. And the reason for this is it's really dependent on how heart disease actually affects your body. So not everyone is the same. Some people take, similar combinations of things, but it's really dependent on, your specific clinical course, allergies, how well you tolerate things, past medical history, stuff like that. So never compare what you're taking to what someone else is taking and feel like you're missing something. It could just be that you have different needs than someone else. And another big thing to remember is that, unfortunately, we don't have one pill that takes care of everything. So a lot of patients are going to need more than one medication to help with the various ways that heart disease affects them. So what we're going to talk about today are 3 or 4 kind of main classes of drugs. So we're going to briefly go over some medications that treat hypertension or high blood pressure. Then we'll talk about some medications that work basically within the clotting cascade. So they affect how fast and quickly our body creates a clot. So those are drugs like antiplatelets, such as aspirin, or anticoagulants. And then, of course, we have to talk about our drugs that treat high cholesterol or hyperlipidemia. So we'll talk a little bit about all of those, but we'll go ahead and start out with hypertension medications. So this is a topic that could be a whole presentation within itself. So I tried to really just focus on the most common medications for hypertension. Like I said before, if you're on one of these and you have a question, or maybe I don't go over the specific medication you're on, throw a question in the chat box, email me. More than willing to talk about anything that we talk about today offline, or any other medications you might have questions about. So to start, we are going to talk about diuretics. So I grouped all of these high blood pressure medications into the types of drugs that they are, but diuretics is kind of a big class. So these are medications that work by helping your body to get rid of extra fluid. Mainly it helps getting rid of extra salt. Anytime that we have salt go somewhere in the body, we know that water usually follows. So by doing this, it helps to decrease blood pressure. These are fairly benign medications in terms of how well they're tolerated. So usually not too many complaints from patients about side effects. If you do have some, they tend to be more about electrolyte changes. So maybe not staying hydrated enough, pretty easy here in Florida, especially in the summer. Sometimes patients can have some issues with their potassium, but usually easily monitored by a physician. So not too much to be concerned about. So if you look at the little green chart towards the bottom of the screen, you can see some of the commonly known diuretics. So everything on the right is the generic name of the medication. These are all relatively older medications, so they are all available generically. I put the brand name there just for reference on the left side, but all of these are usually just going to be filled generic, so which is good, so they're cheap. I think hydrochlorothiazide, that first one there, actually was free for a while at Publix. Don't quote me, not sure if that's still the case, but they are very inexpensive. So all of these drugs work a little bit differently, but they all achieve the same end result, which is usually helping to decrease blood pressure by getting rid of extra fluid. Okay, so moving on, so this is actually two classes of blood pressure medications, so ACE inhibitors and ARBs. These are fairly older medications as well, but work super well, very commonly used, and really work fantastic for hypertension as well as a few other things. So they work similarly, which is why we discuss them together. So ACE inhibitors came first, and then probably about 20 years or so ago, we had the ARBs released to market. And really the benefit of the ARBs over ACE inhibitors is basically just that it doesn't cause this kind of like dry, nagging cough that some people can get. So the most commonly known ACE inhibitor is lisinopril. There's also benazepril and ramipril. And then the most commonly known ARBs or ARBs are losartan, valsartan, and candesartan. So once again, generics are all listed on the right and the brands are on the left. And how these drugs work is they basically block the effects of a hormone called angiotensin within our body. So angiotensin gets released and it causes blood vessels to constrict or kind of get smaller, which obviously increases blood pressure. So all of these drugs work by blocking the effects of angiotensin within the body. The other cool thing is that they've been shown to prevent kidney damage. So a lot of patients that maybe don't even have high blood pressure, maybe patients with diabetes that have protein in their urine, things like that, we will start these medications on because they do have other benefits just besides lowering blood pressure. Also, once again, pretty well tolerated. As I said earlier, some patients on ACE inhibitors can sometimes have this dry cough. If that is something that you've experienced or maybe you're still experiencing, talk to your doctor. They can switch you to one of the ARBs or ARBs. They don't usually cause that as much. There's no harm in the cough, but obviously can be pretty annoying for patients. They both can cause some increases in potassium levels, usually nothing to worry about, can just be kind of monitored on labs. And then sometimes allergic reactions. Obviously, this is a little more worrisome. Usually this does occur more often in African American patients. Can happen anytime when you're taking these medications, not necessarily just at the initiation of the drugs. So just something to be aware of. If you are taking them, you start feeling like you're having difficulty breathing or mouth swelling, tongue swelling, definitely a kind of an emergency situation. Stop taking the medication and usually seek out some medical care at that time. But once again, really common drugs, they work well, we like them. So they do what they're supposed to. Okay, so moving on to our next class. So these are drugs called beta blockers. So you can see the most commonly prescribed ones are probably the top two. So metoprolol, which comes in either once a day or twice a day formulation. Carvedilol, And then the less commonly used propranolol and atenolol. So well-tolerated drugs, and they work basically by decreasing how fast and how strong your heart beats, which by doing so kind of decreases blood pressure that way. So we use them for high blood pressure, but we also use them to treat a bunch of other disease states as well. So they can help with arrhythmias. So earlier I said the most common arrhythmia that we always talk about is AFib. These drugs are great for treating AFib. They slow down the heart rate. They also can help patients that have chronic chest pain or angina, kind of decrease the work of the heart that way. And they're also used to prevent heart attacks in patients that have already experienced one. So we call that secondary prevention, but usually it's kind of a check mark to make sure that all patients that have had a heart attack go home with one of these medications. Once again, usually well tolerated by patients. Some people say that they can have some like coldness in their hands and feet or constipation when starting out. But besides that, usually not too many concerning side effects to be concerned about. So moving on is a similar class of medications called calcium channel blockers. So these work similarly to your beta blockers, but a little bit different. So these are drugs that slow the movement of calcium into the cells, mainly of the heart and blood vessels. So they don't do anything to affect the amount of calcium. They just decrease how fast calcium is moving into the cells. And by doing so, kind of allows the heart to work less strongly. Basically just decreases the work of the heart and then therefore also decreases blood pressure. As I said, similar to beta blockers, they're also used to treat a lot of different disease states, so arrhythmias like AFib, chronic chest pain, of course, just high blood pressure as well. Side effects usually tend to be more common when you're just starting out on the medication. Patients usually adjust pretty quickly. But some people can have some dizziness or potentially some swelling, usually in their lower extremities or legs and ankles, and potentially a low heart rate. So the most commonly known drugs here are going to be amlodipine or nifedipine. We also have diltiazem and verapamil. We use the top two a little bit differently than the bottom two, but all pretty well tolerated medications. They're all available generically as well at this time, so all pretty cost effective. And then moving on, so this is kind of a random assortment of a lot of the blood pressure medications that are left. So these aren't as commonly seen or as commonly used, mainly just for blood pressure, but we can use them for other things. So the first that we'll talk about are drugs that are called central agonists, and these actually decrease blood pressure by working within the CNS. So they work on receptors within the brain to decrease blood pressure that way. The most commonly known drug here is going to be clonidine, an older medication, very effective at lowering blood pressure. Unfortunately, it does have to be taken 2 to 3 times a day. So not the best medication in terms of, remembering to take it every few hours. It does come in a patch, which is just once a week. So that can also kind of be a benefit to members or patients that maybe can't remember to take something 2 to 3 times a day. Another older drug, very rarely used for blood pressure anymore, guanfacine. You may hear or you may remember, but usually not used very often, but works very similarly to clonidine. The next group are called alpha blockers. So these are drugs like doxazosin, prazosin, and terazosin. These are also pretty effective blood pressure medications. They do sometimes cause a little bit of dizziness because they are so effective. So we often will encourage patients to take these at bedtime. That way, if they do get dizzy, hopefully they will just sleep through it. But the way that these drugs work are they just cause blood vessel relaxation and dilation. So it helps to decrease blood pressure that way. Often we see these used more for BPH in men. So in addition to relaxing blood vessels within the body, they also relax blood vessels around the prostate. So for men that have BPH symptoms, it can help with that. So if you have both, sometimes it's a great drug to kind of take care of two problems with one medication, or two birds with one stone. So you may sometimes see these medications used for both of that. And then last but not least, we have our vasodilators. So they work similarly. They relax blood vessels, causing dilation, and therefore decrease blood pressure that way. So hydralazine, somewhat commonly used, unfortunately, is also a 2 to 3 times a day drug. So not the easiest to take. Minoxidil, which is actually the active ingredient in Rogaine, you can also take orally to help with blood pressure. Kind of an older medication, but very effective. And then isosorbide, usually not used solely for blood pressure, but in patients that maybe have chronic chest pain or heart failure, that can be a good option because it will treat both of those disease states. So that's it for blood pressure medications. Like I said, it was a brief overview. So if you guys think of any questions or have any questions, feel free to ask. So moving on, we will now talk about anticoagulants or blood thinners. So as I said before, heart disease leads to buildups of plaques within the body's blood vessels. And really when this becomes a problem is when these plaques are exposed and can cause blood clots, which leads to decreased blood flow to vital organs such as our brain or our heart. And that's when you get things such as MIs or heart attacks and strokes. So the way that these drugs work is they help to slow the rate that your body forms a clot. So they help to kind of prevent those blood clots that lead to blocked blood flow. So they don't completely prevent you from forming one, it just slows how fast the rate is. And as I said, these are oftentimes called blood thinners. Kind of like a little bit of an inaccurate terminology. They don't actually thin the blood, they just work on substances within the blood. These are not usually used for preventative prophylaxis for everyone. It's often used in patients who are at a high risk of a blood clot, or mainly in patients that have already experienced a blood clot. So like I said, not used to prevent heart attacks, but maybe can be used if you've had events, so something like multiple stroke. So we do have some newer medications. So if you look on the left-hand side of the chart, you'll see the brand name, and once again, the right is your generics. So the first one, warfarin, pretty well-known drug. In terms of drug lifespan, it's an older medication. I believe it was introduced on the market in the 60s. So kind of one of our older ones, but works really well, but does come with some requirements for monitoring, lab monitoring, changes in diet. So with that being said, we now have 3 newer medications. So that's Eliquis, Pradaxa, and Xarelto. These are all new within the past 15 years. And in terms of pharmacy, we're kind of an exciting thing to come to the market because they all really replaced warfarin. So not as much monitoring, not as many changes in diet, things like that. So a little bit better for patient quality of life. So all of these can kind of be used a little bit interchangeably, but they all basically achieve the same thing of helping to decrease blood clots within the body. And something that's kind of similar and often talked about together are going to be antiplatelet medications. So these are drugs that also help your body from forming blood clots by decreasing platelets sticking together. So remember we talked about the anticoagulants and how they work. These work similarly, but just at a different stage of that clot formation. So they decrease how sticky your platelets are. So these are drugs that are really helpful to prevent heart attacks and strokes, especially in high-risk patients. You don't necessarily have to have already experienced that event. or in patients that have already had one. You can use these with anticoagulants. Just to note though, if you are on both, anytime you're adding medications that can increase your risk of bleeding, then you're going to get a cumulative effect, right? So 2 medications that can increase your risk of bleeding are going to be worse than just one. So just little things to look out for, falls, bleeding gums when brushing teeth, things like that. So of course, our most commonly known drug here is going to be aspirin, which is number 1. And then of course, we have some newer medications such as Plavix, Effient, and Brilinta, all very similar, and you can use more than one of these at a time, but it would always be aspirin plus one of the other 3 to kind of help with clot prevention and preventing any of these events. So that brings us to the question that I guess is the $1 million question of the day, right? So should I take an aspirin every day? And there's really not a black and white answer for this for everyone. So there are definitely some patients that are going to benefit from taking an aspirin every day, but it is something that you have to weigh the risks versus the benefits. So it's not really a blanket statement. Everyone should take an aspirin every day. Let's just put it in the water. So it's something that you need to kind of talk about with your physician that is familiar with your past medical history, your risk of having these events, and whether or not it's really worthwhile. So aspirin is pretty well tolerated, but there are some side effects associated with it, mainly, of course, bleeding, especially GI bleeding. If you've ever taken an aspirin, you might know that it upsets your stomach. So it can also cause GI ulcers. So those are kind of your risks of aspirin therapy. And then if you do speak to your doctor, you decide that, hey, the benefits definitely outweigh the risks, let's go ahead and start an aspirin. Make sure you also clarify what dose your physician is wanting you to start. So there are 2 strengths of aspirin available on the market. So you have your 81 milligrams and then your full dose 325 milligrams. The vast majority of patients should just be on an 81 milligram tablet daily. We call that a baby aspirin, but there are some people that should take the full dose. So just kind of clarify with your physician. Of course, the higher dose, the higher risk of side effects. And the other thing that we always get is, okay, so it's baby aspirin for babies. Actually, aspirin should not be given to any children. We just call it baby aspirin because it's a baby dose compared to the 325. So probably not the best terminology. But yeah, if you're ever looking for aspirin for baby aspirin, it's just with the normal aspirin and the NSAID or pain reliever aisle. All right, and then last but not least, we're going to talk about some cholesterol lowering medications. So we know that cholesterol lowering is a huge goal when we're talking about heart disease, because too much bad cholesterol or LDL that builds up can cause formation of those plaques within the blood vessels, which once again is what leads to heart attacks and strokes. So you can see heart disease is kind of a problem that we attack from many different sides. So this is just helping to reduce those plaque buildup in the first place. So we have a few cholesterol medications, and most of them help to decrease the bad cholesterol, which is LDL, whilst increasing the good cholesterol, which is HDL. And of course, no drug is a perfect solution and does everything on its own. So all of these do need to be used in combination with a healthy diet to help decrease cholesterol levels. So really the mainstay of our cholesterol treatment is a class of medications called statins. Once again, an older class of medications, work super well and really have benefits outside of cholesterol lowering. They are thought to help with inflammation in the body. They're sometimes used in different disease states. For example, we used simvastatin during COVID to help decrease inflammation for some of the patients admitted to the hospital. So kind of a cool class of medications that do a lot of different things, but their main benefit is that they help to decrease cholesterol. And once again, decrease bad cholesterol and increase good cholesterol. So these drugs are really well studied. They have a lot of research kind of proving their worth. Not only do they help prevent events, so events such as heart attacks and strokes, but they also have been shown to improve survival and life expectancy of patients that do have heart disease. The way that they work is they decrease the amount of cholesterol made within the body, mainly within the liver. So like I said before, the big thing here is to help to decrease that cholesterol, but also help also with a healthy diet. And we had a question in the chat box: if a person is prescribed statins, will they ever be able to get off the medication? It's possible. So a lot of patients, if their cholesterol improves, if they start dieting, regular exercise, making some good healthy swaps, patients can definitely get off statins. If you are someone that has taken a statin for a long period of time, I would always say that's not necessarily a sign that you failed and you have to stay on it, because they do have a lot of benefits outside of just cholesterol lowering. So sometimes for some high-risk patients, if their cholesterol is not even very high, or if it's normal, we'll go ahead and start a statin, because just the presence of these drugs from all the other benefits they have can help to decrease mortality and improve health outcomes. So it is possible if you're just using it for cholesterol lowering, you could definitely get off the medication. But a lot of people are going to stay on them indefinitely because they do have so many other benefits as well. But yes, great question. So all of these end in pretty easy to remember statin. So our two newest statins are thankfully generic now, atorvastatin and rosuvastatin. These are the two preferable statins because they work super well. We also do have simvastatin, which is an older one, and then pravastatin. So a few different options here. Like I said, all generic at this point, but great drugs. Can't say enough good things about statins, and pretty well tolerated. Some people say that they have the muscle aches or pains when they start them. They can have some effect on liver enzymes, usually easily monitored with just some routine lab work though. And for completeness sake, I'll briefly talk about some other cholesterol lowering medications. I know I sound like a broken record, but really, ideally, anyone that needs a statin should be on one. So these are medications that should only be used in one of two circumstances. So either someone can't tolerate a statin, maybe they're allergic, or maybe they're on a statin and they still need some more cholesterol lowering. So the first ones here are these PCSK9 inhibitors. So these are newer medications, probably within the past 7 years or so. They work well, but they are expensive and they are injection only. So not super popular. Usually insurance is going to require members or patients to have a reason why they need these. So not super commonly used medications. We also have some oral options, so Zetia, fenofibrate, and niacin are some other options. They can help as well. Usually not some significant cholesterol lowering with any of those. It would often be in combination with a statin, but you might see those as well. And niacin is available over the counter. Some people that want to maybe take a more natural route will opt to go the niacin route. I would just encourage you to not take the flush-free one because it has not shown to have as good of outcomes. And then, of course, I can't leave without doing my my standard pharmacist spiel about importance of adherence and just taking your medications every day. So this is something I know it's much easier to say than to actually remember to do. But really, we can't stress the benefits of taking medications as prescribed on time every day. This is what improves outcomes. This is what keeps people out of the hospital. So there is a reason why we really stress compliance and taking things routinely. If you are someone like me that struggles to remember to take medications, There are a lot of cool things available now. I know a lot of people will use cell phone reminders, so either setting an alarm on their phone. There's a few apps you can download that will remind you as well. So remember, we always have our cell phones, so kind of use it to your advantage and put your medication reminders on there. There are a lot of really cool pill boxes available too. So these are all photos I pulled off of Amazon. So I think we're all used to this photo kind of in the upper right. So just your standard pill box, every day of the week, and then, morning, lunch, and evening. But there's some cool ones now if you look down at the bottom left. So this is a electronic pill box. It has an alarm and reminds you every day at a specified time that you set to take your medications. And it also can track when each little pocket was last accessed. So if you say, oh, I always forget to take this, did I take it this morning? You don't want to double up. Things like this can be super helpful because it will tell you whether or not you opened it and if one's been taken. Same thing with the photo on the bottom right. So these are just bottles that you can actually buy off Amazon to pour your prescription bottles in. Once again, it has an alarm, and then also kind of cool, an alarm will go off if you are 20 30 minutes after missing a dose of your medication. So a lot of different strategies out there right now. I'm sure there's some cool ones I don't even know. So if you are someone that struggles to remember to take medications, Amazon is your friend. Tons of cool things on there. Another thing that can be helpful is if you do use a chain pharmacy to sign up for their automatic refills. They'll just go ahead and fill a medication, for example, 25 days after it was last filled. That way, when you run out, just go to the pharmacy, they should have it ready. And like I said, why we stress this so much is because missing even a few doses and really even missing one dose can have an impact on your health. When we're talking specifically about blood pressure, there are a few drug classes that when you miss a dose can cause what's called rebound hypertension, which is essentially really uncontrolled hypertension. So this happens often with drugs like beta blockers or clonidine. So things to watch out for if you feel like your blood pressure is suddenly out of control, and then maybe you realize, oh, I haven't taken my beta blocker, for a few days. So there is a reason that we really stress this. Like I said, lots of cool resources out there now. Lots of different pill boxes, apps, things like that. And then other things to remember, talk to your doctor or your pharmacist. So I know doctors don't always have a ton of time. As I offered, I'm more than willing to help you guys if you have any questions about your medications. But even your pharmacist at your chain pharmacy, they are the most accessible healthcare professional that you probably interact with. You can just walk into a Target or a Walgreens and speak to a pharmacist. So I always encourage people to write down questions before they go to talk to a healthcare provider, because it's really easy once you get there to forget what you were supposed to ask. And ask other things, do my medications interact with each other? Is there anything I should be taking that I'm not? We always do encourage members and patients to fill all their prescriptions at one pharmacy. So not necessarily one specific pharmacy, but at least one chain. So a lot of patients don't know this, but for example, if you go to a CVS, every CVS can see what medications you're filling, regardless of what store it's at. But if you go to a CVS and a Walgreens and maybe sometimes Walmart, none of those three pharmacies are aware of what medications you're taking outside of their chain. So it's very hard to figure out about drug interactions, duplications, things like that, if your pharmacist doesn't really have a full picture of everything that you're taking. I know it's sometimes hard, especially with drug shortages and stuff, but we do encourage you guys, try to stick with one pharmacy just for completeness of care and for safety. And then, of course, because I do work with Gator Care, I always throw this in. So if you guys have never done so, I would strongly encourage you all to go to the Gator Care website. Lots of cool updates on there. And then I think like the most helpful section, of course, is going to be the pharmacy section. There's like a breakdown of where you have to fill certain meds. what your anticipated copay might be, things like that. But if you go to the pharmacy tab as well, there is a formulary lookup tool. If you want to know what any medication is and to see if it's covered by your insurance, just type it in and that will immediately pop up. If you're not someone that's really like web savvy, there's also a phone number on the back of your insurance card. Feel free to call. And the helpful people at Magellan should be able to walk you through what you're supposed to be taking or what is covered as well. And then, of course, like I said, if you have any questions, you can also direct them to me. So there's my email address. Thank you guys for listening. If you have any questions, throw them in the chat box. Otherwise, I hope you guys have a good afternoon. And as John said, he is going to send out my slides. There was a question about Paxlovid. Paxlovid is actually a pretty short course. It's only 3 days. I think it's 3 or 5. The question says, hesitated using it because of drug interaction. Usually, kind of depending on what medication you're on, since it is a short course of Paxlovid, it's usually safe to just continue everything. Kind of hard to make a blanket statement about that, though. Sometimes what we will do is just tell patients to like hold a medication for the few days they're on Paxlovid. But Paxlovid, really like good data supporting its use, keeping people out of the hospital, and seems to work pretty well. All right.